the American Psychological Association has done extensive surveys, and the identification now is approximately 1 out of 5, which is 20% of Americans are suffering from some sort of mental illness. I use that term advisedly because illness, it makes us sound like we're sick as opposed to suffering from something.
Right.
So we need to separate that out. What's happening is that, first of all, life is stressful. That's just a fact. And one of the problems that we have generally in America is that people are educated for all kinds of things in school, et cetera, but no education is given how to handle life, how to handle stress, how to handle our well-being. One caveat, there have been some studies using a brief meditation with school-age children in classrooms that does demonstrate that they do better behaviorally. There's less discipline problems. Academics go up and so forth. So, but that's few and far between. So we enter life very ill prepared for all of its stresses and demands. And that's actually, unfortunately, been filtering down to younger and younger people like Ava. Because,
well, you're not mentally ill.
We're not mentally ill.
You're young. That's it. That's all.
But you're suffering from being in the same room as us. So you are absolutely suffering.
Exposure is the problem.
It's tough. But the idea, I love that, because the idea that children are actually humans is a radical concept, that children actually have mental health needs that might even be equal or somewhat more important than us as adults. Right. We're not laying that framework. We don't have the groundwork there. So when they grow up without those tools in place, if you don't know how to be mindful, if you don't take time to breathe, like no one teaches you how to breathe. Yeah. I do breathing as part of my yoga stuff. Yeah. I didn't know how important breathing was. No one showed me how to use my body to breathe and calm myself down. Now, that's pretty important for someone who wants to calm down, right?
Right. Well, and then he's saying that, adults are ill prepared, and then they're having kids and just dumping all their crap on the kids and then not preparing them. And then we have these stigmas around mental health that is very, it's pervasive still today about mental health. Oh, you don't want to be crazy, And so then they don't even address these issues with children.
Yeah. I mean, I want to put the emphasis on the fact that these are learned skills. And they can be taught, and the earlier they're taught and the longer people practice, physical and mental, emotional well-being, the better off people are going to be. So what happens is adults walk through my door having a ton of problems, but they don't have a skill set. So therapy, yes, it develops insight into how we function internally, et cetera, but it's also teaching these skills. And one of the things about this is the paradox: the more stressed out we are, the harder it is to make the life changes. Yeah. That's really sad and unfortunate. And once again, teaching younger people can make an enormous difference. So we have to work with this as best as we possibly can. And going back to the mental health / illness crisis in America, and I was going to say about younger people, but with the advent of social media, and it's not only younger people, but it is also adults. There used to be downtime. I'm older. I used to come home from school. It was done. Whatever jerky things were said or done or happened at school, I got away from it. Now 24/7, young people are LinkedIn.
Nobody uses
They're not
LinkedIn.
They're not LinkedIn.
Not yet.
But on multiple social media platforms, this is happening to them constantly, and a lot of adults too. We've got a bad case of device addiction now. So the stress is constant. People give up sleep because there's only so much time of the day. They, drive through, fast food. I've been in a lot of places in this world. I've never seen all you can eat in any other country than America. Right. This goes
number
on.
one, Dr. Dresdale. We're the best. Sizzler, baby.
Yeah, right. Et cetera, et cetera. And so, we're pushed in this direction that actually doesn't honor our well-being. Right. Corporations make money, I'm sorry to say, of us not being well. And then, as you mentioned, Neal, other corporations make money selling all kinds of stuff to try to make us better. So let's go back to the basics. What can we do? It's small steps. No one's going to change everything at once, but I'm fond of saying one push-up's better than none. So anything we do in a direction, and you mentioned, Mark, setting goals, it may, and I say to my patients, be patient.
Yeah.
Weeks, months, maybe even years. But if you stay with it, the slow evolutionary change of learning how to change your lifestyle habits and your mental, let's call them mental habits, of coping with stress, etc., will be eventually successful. Because right now, the pandemic wiped, we were having problems before, yes.
Right.
The pandemic just destroyed so much. I had a flood of former patients return at the beginning of the pandemic.
Yeah.
We've got economic crisis. It's worldwide. It's not just here in America.
Yeah.
It is worldwide. And there are studies that have demonstrated very clearly when economies go down, mental health, domestic violence, substance abuse, all kinds of adverse behaviors go up. It is, it's really critically involved because the stresses on people are intense and people don't have the skills about how to cope with those stresses.
Yeah.
And it just becomes, unfortunately, like a snowball, going downhill. It just gets bigger and bigger. And what keeps happening is the services were cut. We used to have an excellent community mental health system prior to the 1980s in America. There was here on Broadway, I mean, there was a storefront clinic. People could walk in. Well, budgets got slashed. Psychiatric hospitals got closed.
It's really funny how mental health and pharmacy are the two components of a health budget that always get cut first.
Well, it's like
banned.
What it feels like is we don't have the money for it. Is sort of and there's not an appetite for. We need to as a society come together and meet this need. So when you had community mental health, when you had psychiatric hospitalization as an option, folks who are now in jail wouldn't be in jail because we would have medical treatment for those folks. And so now, if you look at we can get into the sort of the prison complex situation, but that's the only place left for folks who have this level of severe mental illness. So there's no place for them to show up and go. So if you honestly just walk into a place and rob the local mobile mart, you're going to get better services than if you were to walk into a clinic that would be available to you. And that's the part that we really struggle with here is getting past the stigma, getting past this idea that somehow I'm broken. The idea of suffering is very true, and we talked about this placebo effect here a couple episodes ago. That if the dog wags his tail while he's eating his medicine, he's going to have a better efficacy of the medicine, right?
Yeah.
This mindset stuff that Dr. Dresdale's kind of highlighting. If I can just believe that I can do the thing, if I tell myself I'm going to do better, or I'm trying to do better, or I can set realistic short-term goals with a professional like Dr. Dresdale, I can see that slow incremental change and I can start feeling better. And when I start feeling better, I'm more engaged, I'm more likely to continue down that path. If I feel hopeless and I don't reach out to Dr. Dresdale and I don't make any effort at any of this stuff, I stay stuck. That paralysis that you were talking about, this idea that I'm not even going to ask for help because I'm so overwhelmed, I don't have a plan, I don't even know where to start. That stops more people than anything, I think, personally. I think that's more dangerous than somebody who's at least saying, all right, I'm going to at least try something here. That would be better than the alternative, which is folks just don't reach out.
Right. I mean, so there are people like Mark's saying on that extreme end, the prison complex system, which is like the house for mental health, like severe mental health problems these days, it seems. But then there's everybody else, right? And we're all dealing with some sort of baseline. Things are heavy, things aren't right. And there are mechanisms for us to kind of deal with that. And the other piece, I guess, with the American mental health crisis, we touched on is our perceptions of mental health professionals, thinking that they're just one thing, as you said, but they have very specific disciplines and they need to be matched. And part of the problem when it comes to pharmacy mental health and the pharmacology side of it is that we're experimenting a lot of the times because we're trying to deal with human emotion and how these chemicals interact with our complex mental health systems. It can be very frustrating, and failures, quote unquote, can make people with stress and anxiety and depression more anxious and more depressed. And so it is a very, very challenging navigation, but I would say the biggest hang up is the thing that you talked about, how, or actually I think it was Mark. Basically, if I talk to a mental health professional, if I go see a shrink, they're going to put me on medicine and they're going to drug me up and that's all they're going to do. And they're not holistic. to be quite honest, I kind of feel like it's opposite, like you were highlighting, the idea that if you go to see a mental health professional, it's more about the therapy than it is about the medication. And the medication, the nutrition, the exercise, the perspective shifts, the daily practices are more important to the work and to the success than the medications. The medications help with the physical part of it, right?
It gets rid of the alligators.
Yeah, it gets rid of them alligators.
Yeah, when it's appropriate. Yeah, I mean, it's a very serious issue. One of the things I say to my patients is, you're having a normal reaction to an abnormal situation, and it gets pathologized. And people are under a lot of stress, and anxiety is on the rise, and depression is on the rise. And because people are so stressed and they're running as fast as they can, it seems like a simpler solution if you can take a pill and everything goes away. But as I said earlier, it may help with symptomatic change, but it doesn't change your life. The only thing that's going to change your life is you. You have to step in. And once again, I have people come and they say, I don't have time.
Yeah.
Well, neither do I. But I make it a priority, and I say, okay, but you said you don't have time, but can you walk up and down the hallway right now for 5 minutes?
Yeah.
I have we're going to get to meditation and mindfulness later, but I have my patients start with meditation. They go, I don't have time to go to, an ashram and meditate all the time, or temples in Thailand. I say, no, we're talking 5 minutes in the morning. Can you give me 5 minutes in the morning? Can you make that commitment to yourself? And they go, what good is that going to do? I said, let me show you the research. Mm-hmm. And you mentioned earlier, by the way, the lifestyle factors and these interventions and how they positively affect mental well-being.
Yes.
There's a raft of research out in good research in respected journals that clearly demonstrate when we take care of the lifestyle factors and we use these interventions to reduce stress, anxiety, et cetera, they make positive changes, and it's very, very clear. Other countries approach mental well-being in a different way than we do. For example, in England, but they have a national health service. They can make a decision at the top, and then that becomes policy in how certain conditions are dealt with throughout the system.
Right.
We don't have that. Holistic is a word that's bandied about, but we're very fragmented, right, in all of this. And we have a lot of research, but it's not used in a systematic way, in a integrated way throughout our entire healthcare system, which is really too bad.
And we'd all benefit from putting our phones down. And so this
we're just
idea,
making important things important.
But and we don't. What we do is we compare ourselves to everybody's highlight reel on the internet. We look at somebody else's TikTok or Facebook or Instagram, and we say, that person's further ahead than I am. Mark's really good at stretching now, so I'm not going to start stretching. Mark started stretching at 420 pounds. Mark was not good at stretching when he started. No one's good at the thing when they start. My daughter has the same thing. She's 10 now, and she has to be perfect at it. She had her first trumpet lesson, and she couldn't do everything she wanted to do with the trumpet. So she's like, well, I'm not very good at the trumpet.
It's mostly bad parenting, though, right?
It's a parenting issue for sure. I mean, there's no getting around that. But this is what we're up against, right? So this idea that if I fail, right, and we talked about failing here, these are lessons. We're learning stuff. But even from a young age, as a 10-year-old who's sitting there going like, I just can't do this. I'm throwing my hands up. I'm not any good at this thing I've never done before. That's the approach we're up against, which is I'm not any good at breathing. I don't know how to meditate, Dr. Dresdale. I'm asking you for 5 minutes. All right, 5 minutes is too long. What? But that's the same thing if I say to somebody, hey, I need you to stretch 5 minutes a day. If you stretch 5 minutes a day, you will see physical benefits from 5 minutes of stretching. I don't have 5 minutes. Well, you do.
Yeah.
You're just throwing up roadblocks ahead of this to say, well, this is probably not going to work for me anyway, so I'm just going to not try. And I think that's what's going to defeat you more than taking an action. And that's what we're trying to encourage you towards, these basic, simple steps, these practical steps that you can take right now. We're going to get into the physical pieces of it in a second. But the mindset has to be there that this is something that's going to be successful. And if you don't have that mindset, you're not going to continue down that path. You're just going to start and go, well, Dr. Dresdale's a quack, and I'm not going to do the thing.
Yeah.
And we're trying to really buck up against that.